Hi, this is Richard Kennington, the CEO at Watertown Regional Medical Center. I'm here with Amber Francis, who works in our cardiac rehab department. Hey, Amber, how you doing?
Hey, good. How are you, Richard?
Good, good. Thanks for speaking with me a few minutes today.
Definitely.
So, hey, just tell us about cardiac rehab. What is cardiac rehab? When should people get cardiac rehab? Just kind of give us the story about what you do there.
Yeah, so in cardiac rehab is a program designed to promote lifestyle modifications in patients and improve their quality of life through exercise, education, and support post heart event or heart surgery. So we use medically prescribed and supervised exercise with EKG monitoring. So this allows us to safely increase our patients' exercise levels and allows our patients to gain confidence and return to their normal activities after a big heart event or heart surgery, because that can be kind of scary for patients after something like that happens. We also use cardiac education classes where we cover various topics such as heart and vascular disease risk factor education, nutrition education, stress management topics. And we're also there to provide a support network for patients and answer questions and be there for our patients and their families. And so the individuals who should participate in cardiac rehab would be patients who have had a heart attack, heart surgery, such as a valve repair, valve replacement, or coronary artery bypass surgery, stent placements, heart failure patients, heart transplant patients, or individuals with peripheral vascular disease.
And thanks for that overview.
Yeah.
When I think about cardiac rehab, I think about, if I had a cardiac disease, I'd probably be a little nervous to go exercise on my own because I'd be like, what if something happens or something? Do you
Right.
find that people like to, how do people feel when they're exercising after having such an episode? How does that usually go?
Yeah, so normally patients are, feeling that way, just like you described. They're afraid to exercise or exert themselves. Oftentimes, that's when patients find out, that they have a heart disease or they have a heart attack. Is
Right.
typically when they're, doing some sort of activity and they start, feeling chest pain or shortness of breath or, any of those symptoms suggestive of heart disease. So they're scared to get back to doing that
Right.
event, that type of activity that caused that event. So usually there is some nervousness involved, but like I said, we do EKG monitoring so we can see their heart rhythm, their heart rate. We check their blood pressures, their oxygen saturations, so we're checking all of their vital signs and checking in with them while they're exercising so that we can safely increase those exercise levels so they feel confident when they're able to return to normal daily activities.
Great, great. So you were just kind of going over some pretty technical things like your monitoring vital signs, EKGs, all those kinds of things.
Yeah.
What kinds of education do you get? Because that's pretty technical, the things you're doing. So what education do you receive and how does one work and become qualified to work in cardiac rehab?
Yeah, so I got my bachelor's of science in exercise science from Carroll University in Waukesha. And then I went on and I got my master's in clinical exercise physiology. And then I'm a certified exercise physiologist through the American College of Sports Medicine.
Got it. Quite a bit of training. Thanks for doing that training
Yeah.
to help people in our communities to get
Yeah,
cardiac rehab.
definitely.
I guess the last question I have, and I think you know this, last year we were recognized as one of the top 100 community hospitals in the country. And when I talk about staff members about that, it's something that a lot of people take a lot of pride in. Why for you
Yeah.
is it important for you to work in an institution that's kind of been recognized with that kind of quality?
Yeah, definitely. For me, I think it's pretty easy to say that I feel confident that I'm providing the best care for my patients,
Mhm.
and that with that recognition, my patients also feel very confident in coming here and receiving excellent care.
Great, thanks. And thanks for talking to me today. Thanks for being great in cardiac rehab. We heard so many great things about you and about your team down there, the work you do for
Thanks.
our patients down there. On a non-work related note, I hear, and I think you know where I'm going to ask, I hear that you recently got engaged. Is that right?
I did, yes. My fiance and I got engaged on April 18th, so recently, and we're very excited.
That's the smile we were hoping for. I can tell
Yes.
you have a glow. You have the newly engaged glow about you. Uh, well, congratulations on the
Thank
engagement.
you.
thanks so much. You do. Our mission is making communities healthier, and the work you do down there is definitely helping us to achieve that. So thank you very much.
Yeah, thanks.
Yep. All right. Bye-bye.
Bye.